Hi, and welcome to Spotlight. I'm Kelly Nash. Today we're joined by Dr. Todd Lefkowitz of Lexington Plastic Surgery, a Lexington Medical Center physician practice, and we're talking about ways to make your face look better for both men and women. Doctor, welcome to the show.
Thanks for having me.
Well, we got to start with face and neck lifts. And what is actually happening to our skin that makes us need a face and neck lift?
Well, a few things happen as we age really appropriately. Really three things that we start to look at. Number one, being in South Carolina, our skin damage that happens to us as we get older is something that occurs. Number two, gravity. Everything kind of goes south. Nothing ever seems to ever go north. And number three, one of the things that we've learned about really in the last 10 to 15 years is loss of fat volume, specifically loss of fat within the face. And when you combine all three of these things, it leads to that typical aging face.
Gotcha. Is there an ideal candidate for this type of procedure?
Really, for anybody that is in good medical health, a good medical condition, that wants one of any of those things addressed in a surgical fashion, typically will do very well.
Another thing that you're working with are people's eyelids. Can you tell me about an eyelid procedure?
Sure. So oftentimes in combination, again, as we age, things don't happen in isolation, they happen simultaneously. For people that may have some excess skin on top of their eyelids or baggy under eyelids, a lot of times we will address those things at the time of the face and neck lift, or separately if that is really the patient's main concern at that time.
Understand. And recovery on that is relatively quick?
It really is. So most people take off about 10 days of work or school for face and neck lifts, usually a little bit less for eyelid lifts.
Understand. Now, holidays are coming up and people might want to get some non-surgical procedures, quick visits to your office. Tell us about what you're doing.
So, we go from the surgical realm to the non-surgical realm, things like Botox, fillers, chemical peels, especially just to kind of freshen up a little bit for the holidays without some of the surgical downtime that you may have.
And we mentioned that male patients are really starting to increase. What are some of the more popular things for men?
That's right. So, very similar. So face, neck, eyelid lifts for the aging male, as well as for the non-surgical treatments that we have for them. It's interesting to note that males actually end up making up more and more percentage of plastic surgery patients these days.
Do they really?
Yes, sir.
All right. So, and you hear about people doing Botox and fillers. Is it better to come to a plastic surgeon?
Well, I'm a little bit biased, but I certainly think that there are a number of great people that can do fillers and Botox. I think when looking for a plastic surgeon, what you really want to do is look for a board-certified plastic surgeon.
That's good to know. Well, you have a big event coming up in January.
We do.
What's that about?
So January 9th, from 5 p.m. to 8 p.m., we'll have an open house at the office. We'll serve some drinks, hors d'oeuvres, and also give a lot of great information for any of the treatments that you may be interested in.
That's fantastic.
Yes, sir.
Well, thank you, Doctor. And if you'd like to learn more about Dr. Lefkowitz or you want to book a consultation, it's real easy. Just go to the website, lexplasticsurgery.com. That's lexplasticsurgery.com. And Dr. Lefkowitz, thanks for joining us.
Appreciate it.
And thanks for you watching Spotlight.